Well, Jim, I'm fascinated and impressed with what you've done with your employees, and I think there are some lessons here that we can pull into this national debate about healthcare. And I guess my question to you is, you talked a lot about penalties for people that don't behave correctly, but I take it you've mainly used incentives or carrots rather than sticks to get people to do this. Give me precisely how you've gotten people to behave better.
Well, it starts with education, which is, we started this 4 years ago, and the first thing we did was say, there'll be no increase, because remember, our cost of ink was going up like 12% a year. And so we said, and we were passing that along. So we said, you know what, no increase if you participate in a WebMD deal we have, where we do a confidential survey just with you. We self-insure, but our Blue Cross administers our program, and if you show up as high risk, then a coach calls you and talks to you and develops
a health coach
to develop a plan to sort of deal with the issues that show up. And 2/3 of our people showed up as high risk, and so that's kind of how we started. Smoke, you know, we were talking about how do you quit. 70% of all people who smoke want to quit. So we had unlimited cost smoking cessation and gave people a year before we sort of got more hardcore and said, in states where we don't have to employ smokers, we won't. And we're not going to hire smokers. In any state we don't have to, we won't hire any smokers just because we don't want the risk. So we've put a lot of incentives in to do it, but we've also found that for people who didn't want to, because that first year only 70% of people participated in something that would have saved the money. And so then we said, you know what, if you don't do the health survey, you're going to cost, I don't know, it's $35 a month or something like that if you don't do the survey. And then if you're high risk, and who most people were really happy with the programs that were developed by an RN, by the way.
Thank you.
You're welcome. Then we charge people more if they got suggestions and said, I'm not going to do them. Because, I mean, it's people's choice. They don't want to do it.
So you started with carrots, then you came in behind with sticks, and you moved the needle on smoking. You said you went from 33%.
Moved the needle, I think it was
7%.
Crazy, you know.
How did you move the needle on obesity?
Not as much. And the reason is that it's pretty much protected class, and therefore the ability to sort of implement premium sort of differential based on weight is under federal, I think it's mostly federal rules, not allowed. So it's hard. They're both kind of addictive things, and they're hard, smoking or eating.